Metastatic melanoma is the most serious and life-threatening type of skin cancer. Here with some important information is medical oncologist Dr. Anna Pavlik and patient and clinical trial participant Gary Larrabee. Thanks to both of you for joining me.
Thank you.
Thanks.
So doctor, starting with you, I mentioned that it is one of the most deadly versions of skin cancer, but how common is this melanoma?
Well, melanoma is one of the few cancers that's actually still on the rise. There are about 200,000 new cases of melanoma diagnosed worldwide each year. And of that, 50% of those patients will have a tumor that has this BRAF mutation. Why is that important? Because BRAF mutated melanomas tend to be more aggressive, and the mutation that happens within the tumor provides us with an opportunity to target that mutation to develop medicines that can hopefully slow down and change the outcome of those patients.
Yeah, and it all starts with being diagnosed, right? Who should be tested for this?
Well, patients need to speak with their oncologist to determine if their tumors should be tested. Again, this is not a genetic abnormality that's transmitted amongst family members. It's a genetic abnormality or a mutation that occurs within the tumor, which is why it really needs to be a discussion between a patient and a physician.
Right, and so the FDA approved something because of a clinical trial. What was that?
So the clinical trial that we're talking about this morning is the Columbus trial. The Columbus trial looked at patients with BRAF mutated metastatic melanoma and randomized them to either receive two medicines, one called BRAF-TOVI, the other called MEK-TOVI, compared to a single BRAF medicine called vemurafenib. What we saw was patients who got the combination of BRAF-TOVI and MEK-TOVI had a better than 15-month improvement in their progression-free survival compared to patients who just got the single-agent vemurafenib, which showed a 7-month progression-free survival. So based on that data, the FDA approved the combination of BRAF-TOVI and MEK-TOVI for patients with metastatic BRAF mutated melanoma. It's very important to know that patients who have wild-type melanoma or melanoma that does not have a BRAF mutation should not be getting BRAF medicines. It's only indicated for patients with the mutation. And that said, it's also important to know that all medicines have the potential to give patients side effects. So some of the common side effects seen are fatigue, nausea, diarrhea, and maybe some joint pain.
Gary, describe your diagnosis of this and how it's impacted your life.
Well, in 2013, I was in good shape, Alex, I thought. I had just gone through a 5-year period of treatment for stage 1 melanoma. But in a short period of time, I developed suddenly extreme energy loss. I developed no strength to walk, to sit. All I wanted to do was lie down. I was having some issue of obviously some consequence. So I checked back with my oncologist, and he determined that I had this BRAF mutation we're talking about had invaded my body, and I was now a stage 4 metastatic melanoma patient, and I had a very grim prognosis. But in short order, my oncologist recommended that I get involved with this drug combination Columbus trial, which was attacking, I guess you could say, the BRAF gene that was attacking my body. And I enrolled in the Columbus trial, and now the Columbus trial is, the two drugs, I should say, involved with the Columbus trial have gotten FDA approval. And I'm here now in 2018.
That's great to hear. And how are you doing now?
Very well. I couldn't be more grateful, and I feel wonderful.
Very good. Well, a lot of important information there, Dr. Anna Pavlik. Gary Larrabee, thanks for sharing your story, and thanks for joining me.
Thanks, Alex.
Definitely. We'll be right back.